from there. So everyone, thanks for joining us. We've got Ben Winfield from Rover Analytics. He was wearing a pink jumpsuit or coat, I guess it was before. Now he got the navy blue message that I might have been sending over his way. So Ben, thanks for joining us. We're really excited about the conversation today. Really trying to help employers try to find the best way deliver that great healthcare for their employees. And we've got this really cool tool that you guys have shown us, and we just want to make sure everyone knows about it. So you go ahead and take over from here. And sorry, just real quick. Again, if you guys have any questions, feel free to ask along the way. Just type in the chat log there, and I'll try to interrupt Ben. Or if you want, you can wait till the end, and then we can circle back on it. So Ben, go ahead and jump in and show us all this cool stuff.
All right, sounds good, man. And yeah, I was hoping you would match my pink, but I just something inside knew he's probably not. So I'm gonna throw the blue on.
I think there's purple in this, so that's about as close as I'm probably gonna get.
All right, fair. So yeah, as I go through the demo here, because my screen gets shrunk up while I'm going through it, Tyson will interrupt me if there's things that you guys want to ask in the chat. Just throw it in there, and then once we're all done, I'll open it up as well for any questions anybody got. And then also Tyson can I speak to like what we're going to do with this data after we can help you get it. So let me get my screen up here and we'll get going.
Great.
All right. Let me minimize that too a little bit. All right.
Yep.
So here we go. So the cool thing about what we can do here at Rover Analytics is we can fetch you claims data on any fully insured group. So even if your group is in a PEO or association, or you're fully insured and you're not getting your claims data, we can help you out with that. So this is a game changer. So the way that this works is we're going to get this data. We're going to pump out these interactive dashboards. And in the end, Tyson can speak to like all the other levers they can pull to help you save money, to build better plan design and better benefits for your employees. And it's all because he can actually see what's going on with the plan. We can look at the last 2 years and see what has been happening and how much you could have saved had you been self-funded and used these different tools. And those are all the kind of cool stuff he can show you. And then also that allows you for predicting for the future. So this is kind of in the end what it looks like, what he's going to have access to. But first, how do we get there, right? So the first thing is we get the data by using the electronic explanation of benefits that's held by the insurance carrier. So we got told once, we're like the Venmo of healthcare. And I love that analogy because if you're familiar with Venmo, you give them access to your bank account. And then Venmo goes in on your behalf and pulls money out to give it to somebody else. So we're like that with healthcare. So every time a claim is filed, whether that's prescription or the doctor visit, it generates an explanation of benefit that the insurance carriers hold. So the employees then give us access to their insurance carrier member portal so we can go in, pull that data, aggregate it, and hand it over to Tyson and his team so that they can then get you better benefits. So that's kind of the process, pretty easy. We get this data, we run it through our software, and then we give them the interactive dashboards. So the entire engagement is actually really simple for the employees. It's 3 simple steps. The first thing is they're going to receive an enrollment email. Now this is going to come to them in email, so they can use this, or they can do this process on their phone if they do have a smartphone, or they can use it from a desktop. So if you have manufacturing employees or you have people that work off-site, they don't have to actually be at a company computer. They can do this from their phone if you can forward the link to them in their email. Now, the link is unique to each person. That's how we track the support and track the process. So the first step is they're going to click the button to complete registration, and it advises them, do not forward this, right? The next step is they're going to verify who they are. It is to say you are this person, just in case someone did accidentally forward it. Then the third step is where the magic happens, where it's easy. They're going to put in their username and password. This is an example of a Cigna plan. And then they're going to click the 2 terms of use, hit submit. That's literally the entire engagement. It takes about 1 minute to do this, okay? Now, before we launch it, we want you to know, like, we've done this with all different types of employees. We've done car dealerships, wind turbine maintenance crews that are out in the middle of nowhere that have no cell service. We have construction companies. Probably our biggest example of like one of our tougher groups was 245 employees that were a property management company. So they're spread across 7 different states, 20 different locations. They have maintenance crews, landscapers, housekeepers, the property management sales staff. They had all these different employees that all work off site. Nobody's at a location. 60% of them were Spanish speaking, very little English. And we were able to roll this out and get everybody enrolled. And it took us about 10 days to do it. So even if you're thinking like, I don't know about my group, we're a lot of blue collar employees, or we're truck drivers and nobody, even has an email, let alone, a member portal. Don't worry, we've done this. We know the techniques and how to help everybody to get enrolled. The whole process from the moment that you guys say, yes, we're ready to get our data until you have your data is about 3 weeks. So in the beginning, we're going to meet with you, our onboarding staff, and your advisor, whether it's Tyson or someone from his team. And we're going to sit down and we're going to talk about, here's the onboarding process. And we're going to set timeline, deadlines. We identify whose responsibility is each of the steps. Then we're going to, while we're doing that, we're going to help you promote the program. We actually have already tailored videos for the employees. We have FAQ sheets. We even have email templates you can use as a, here's the wording you need to say to your employees to help them understand the why, the what, and the how. It's super important that we have their buy-in. And so we give you all of that education and that information up front so that you can get the buy-in. That's the most important step, right? Once we're ready to launch, we provide all the support of tracking it. We'll just give you daily updates as to how many people have enrolled and who we still have left. If we have someone that we just can't reach, we might need to ask like, okay, can we get in touch with their manager to maybe go over there and talk to them, or what can we do depending on the situation? Once we're done, we get our data and we compile it with our other reports and we hand it over. So we do have lots of testimonials. This is a great example of a group that wanted to go into a captive. On the right there, Jonathan Trianfi, he had an 80 life group. He got a quote to take him to a captive, but he's like, man, I know we're a healthier group. Came and got the data, went back, and that same group, the premiums dropped $235,000 because the data proved that they were not as risky as the previous carrier was trying to say they were, right? Because these carriers hold this data hostage. They're just out there trying to control it so they can raise your rates every year. Well, we can actually prove otherwise. Obviously, we've worked with lots of underwriters, and this is just to show that Tyson has support for Biggs Insurance of different TPAs, underwriters that work with, and we kind of have a streamlined process to help with that whole process. So in the end, there's going to be two different types of reports. The first report is one that does have employee names on it, and one that you as employers will never see. This one is for the underwriters, the group that actually has to underwrite the risk. They actually need to know which individuals are on the plan, going to be on this plan, and then also what their conditions are. Then they can follow up and track down what's going on. So you can see like from the EOB data, there might be some blanks, but that's because this is a prescription instead of a medical. So there's no actual procedure code, right? So that's pretty standard depending on the EOBs that we're getting. There's 54 total fields of all this information that we've pulled off, but it doesn't cover everything. So some of our underwriters want to see that overlaid with other information. So certain underwriters want to also see gender and date of birth in that underwriting process. So when they're doing that, we're going to take that EOB file that we just had, and we're going to overlay it with other information that we can get from you through the census data process, or we can find out from you the enrolled members by month or what your actual paid premiums were, so that we can compare it versus claims, right? So that's where the data really gets interesting. So from there, oops, let me go back one. From there is where we pump out the interactive dashboard. Now this is de-identified, and this is something that Tyson and his team can actually show each of you of, here's where the spend is, here's our top prescription spend, here's our top facilities that we're going to. So he can speak to what they can do with this information, but there's a lot of cool things that they can do that they couldn't do before when they didn't have this information. So by having this, there's lots of different programs, care advocacy, medical managers, bringing in a PBM to deal with the pharmacy spend, direct facility contracting with facilities, because you get to see exactly where they're going. So all this information is going to help him to help your group. Again, when it comes to this, all of our program includes all that pricing, includes all the information, but also our employee education is a big part of this as well. We're going to help with the group enrollment. We're going to give you all the education that comes with it to talk to your companies. Now, this does allow Tyson to take this information to go in many different directions. Usually the goal is self-funding. That's where we see the highest savings, but it could be maybe to go to a captive program or to help set up a MERP, just depending on what the data shows. And that's the thing, you're kind of blindly choosing without this data. You can make some educated guesses, but when you actually see the numbers and see what the usage is, it really helps him to build out the right plan for you. We're going to skip a couple of those. So when it comes to the pricing of this, our pricing is based on, number of employees. And so we do want you to know that the pricing here is a standard where we get you historical data, but we're going to finance it over the course of the year. So they're going to price this out over the course of the year for you. So it's going to be $3.50 per employee per month for that year. So we do get the data and then turn the system back off, but we have it broken down because a lot of your billing is already in PEPM fashion. So it just kind of simplifies it. And then you're financing it. You don't have to pay for it all right up front. And then as you generate those savings, it makes it easier to pay for it throughout the year. So that's it. That's a real quick presentation. It's not a long one by any means. So
that's good stuff. Thanks, Ben. Hey, a couple questions for you that I had written down before, and so I crossed off a couple. So that's why I wanted to wait till the end. So just encourage anyone that has questions now. Feel free to type those in the chat. You mentioned being able to help all the different industries and doing some pretty cool stuff with. Doesn't matter how they even speak English very well, or which how many of us do. That probably was bad semantics on my own here. But you had mentioned to me in the past a little bit about the ability to call one-on-one with people. Can you talk a little bit more about that? Because I think one of the challenges a lot of us face with a lot of our employees, or at least segments of our employees, is dealing with the technology lag, or getting someone on the phone. So how do you guys help in that way?
Yeah, absolutely. So we do, our support staff really does cater it to the needs of the group. So it kind of depends on what are your normal channels of communication. So we always start there. So let's say that you have a group that are all on multiple sites. We always start with, okay, so if you had an emergency today and you had to contact everyone, how would you do that? And so we can piggyback on kind of that methodology. But we absolutely, our support starts with outbound emails and then ramps up to actual outbound phone calls as well. We do have a phone line they can call in. So they can call in, every day of the week when they need help. But also if we've noticed somebody hasn't engaged yet, we'll do the outbound phone call. So we are handling the support on this up until the point that, we every now and then we have a couple of stragglers that we just can't get a hold of. Maybe they have our, they don't answer unknown phone numbers, right? Like some people do. And we've left messages and they don't check their messages. So we might, in some cases, have to reach the employer and say, we need someone inside to go tap that person on the shoulder and let them know we're trying to help them through this. But for the most part, we do get a hold of everybody with the outbound phone calls, and we manage this process because it is so simple. We do give a catered package with every group as part of our program implementation stuff. So if they're on Cigna, we give ahead of time, here's exactly how to create your member portal login through Cigna. Here's how to reset your password with Cigna. So we give all that and the steps with screenshots, everything. We give that ahead of time, catered to every specific group. So yeah, so that it just depends on the group and who they're with.
So, and that was probably was going to be my next question is like, we deal with a lot of employers that are always trying to get people to get the user access and that stuff, right? And so, I don't know, 10%, 20% probably even have an online, and probably 1% actually know how to log in, assuming that they have the exact same password, same login that they use for everything else, even though their bank account. So the emails are good, to try to say, hey, look, we're getting set up. Let's go ahead and get that done. But on those one-on-one calls or whatever else, do those people also help guide folks while they're on the call to get it? Because you wouldn't want them to hang up, go get it, and then try to get back on a phone call.
Yeah,
right?
We try and do it while we have them on the phone. And in fact, we do have it on a recorded line. So sometimes we've had employees just give us permission to create it on their behalf and then give them the information. So as long as we have their permission, we can even do it that way. Like we worked with a manufacturing company, but they obviously not everybody has a computer. Everybody's out in the factory. So what he did was he just brought in 2 computers into the break room, set them both up on Zoom meetings. And so we had a support staff on each of those calls, and he just brought people in. They'd sit down on a Zoom. Our support staff would walk them through the whole process. go here, click here. And if they needed help, they take over the screen and just do it for them. But they walk each individual through it. Okay, you're done. Great. You can go, send in the next person. And they just had a day of that, just rotating people through. So it really just depends on what the need is of the client. But we are absolutely going to try and walk them through it while we have them on the phone or on the Zoom. Sometimes we've done group Zooms where if everybody does have access to their own computer or phone, and we just do one 30-minute session and everybody logs in and we walk them through all right then, and everybody does it. We don't move forward until everybody's done each step.
Yeah, better. Yeah, that'd be funny. Like, who's the slacker that's slowing us all down here, right? Everyone's yelling at them to get their phone out. That's funny. Yeah. So you mentioned also, kind of switching gears a little bit, you mentioned the overlay process. So that's where more reporting is going to be available. So what does that mean to the group? I mean, how much information do they need to provide to help with that overlay? Is there standard reports that you're doing for the overlay, or what are you looking for?
Yeah, so it kind of depends on which underwriters we're trying to work with, because different underwriters want different kind of data sets. So for instance, if we know we're working with Iowa Re, they want to see gender and date of birth. So they want to see the age range and the gender on that overlay reporting. So if we know that up front, we'll, as part of the census file, we'll just ask that information on the census file that we're going to upload in the very beginning before we even launch this to the employees. Or we might have to come back and ask for that later if that is an underwriter we want to work with and they need that data. East Coast underwriters, for example, they want to see the enrolled members by months, right? So there's just little variances that we can ask, but it's not us. It's just depending on the underwriters that we're working with and what parameters they want. For the most part, everything's covered by the really simple stuff up front. The name, the phone number, and the email is what we need at a bare minimum to roll this out, because that's part of our support. Beyond that, anything that we're asking is going to be based on the underwriters and their needs. And it's just us being the medium for them, the middleman, gathering it for them. And then we can include that on our reporting. But our basic report is pretty advanced, even without those extra things that they ask for.
And how often would you have, you're not going to go back to the employee and ask for more information. You're going to be going to the group to ask for this extra.
Absolutely.
Right?
Absolutely. Okay. Yeah. It'd just be through the HR or, whoever our contact is at the company that we're going to gather this. Just as a census file, we're not going to individual employees. It's just talking to them. Hey, we just need the contact info, people's information. I mean, people they put their date of birth on job applications, their gender. So that's stuff that the HR manager should be able to accomplish for us pretty easy. So
got it. And so with the overlay information or the one-on-one calls that you showed the PPM cost, is there anything extra? Does it cost any more to do one-on-one calls versus all virtual?
No, that price is fully encompassing of all of our support. We did it when we first launched, we had a pricing, and then if there was like really difficult situations, we had extra little costs, and we were like, no, we need to keep it simple. So that pricing is for all of the support involved. If we have to make one outbound call or 50 outbound calls, the price does not change for us. So we wanted to keep that simple for budgeting, so for people to understand. So that covers our support. Yep, no additional cost for that.
Well, you've also mentioned to me in prior conversations too, which I thought was interesting, is that because this data is so unique, that certain underwriters are actually waiving the fees if you were to work with them, and so that's different. That's, I guess, to say the least.
Yeah. Right? So I do. Yeah, that's a great point. So speaking of both of the underwriters I just mentioned, Iowa Re and East Coast underwriters, they both will reimburse the cost of Rover if you place the business with them. So if you do go self-funded and you pick them for the stop loss quote and go self-funded, they'll either provide it as a reimbursement or an override back. So let's say that we cost $2,000, you're going to see that $2,000 come back to you. Also, let's say that you find out you do have some high cost claimants and self-funding doesn't make sense, but you can build out that MERT program with our MERT TPA. So if you take them there, because now they can see and they can build this out, they're still trying to save you $1,000 per employee per year. So that 80 life group, they're still going to try and save you $80,000 per year. Maybe not the $235,000 that he got, but now that he sees high cost claimants, he can still save $80,000 a year. Again, if you place a business with them, that's like our backup plan, you still get the cost reimbursed. They're going to take it off of their admin setup fee. So at the end of the day, as long as you do something with this data, you can get it back, because we do have partners in place that will cover the cost. But if you get this data and then decide, you know what, we're just going to rubber stamp the renewal. Well, I mean, that's pretty much the only situation in which the employer is going to be on the hook for the cost of service. Because as long as they do something with it, they're going to get it reimbursed from people in our marketplace.
Yeah.
Cool.
And so MERP, just because that may be a term that some people have heard or never have heard before, it's just basically a reimbursement program. It's, you know, kind of leveraging, maybe raising deductibles, out of pocket maximums, and keeping the employees whole with a reimbursement program. So, you know, the employer's risk is super limited, right? Because it's just that additional amount that you're raising, and you got a pretty good idea about what the claims cost or what your exposure is. And so you're just playing the premium game. And I think the greatest part of this is that you're able to justify what you're actually, you know, are you in the right place, right? Because as you mentioned, self-funding isn't for everybody. You know, there's certain situations, or there's plenty of situations where it just doesn't make sense. And so being in a community rated pool or a fully insured plan, large group, may be the right place for the company. But this is, you know, an additional feature that you can enhance the benefits. And so that's pretty awesome that they, like you said, it's probably the best way to say it. As long as you do something with the data, then, you know, then you're actually, you know, it's not going to cost anything. So why wouldn't you take that step, right?
Yeah, I mean, so far, I'll say this. I mean, so far we've found that everybody that's gotten the data, there's been something they could do with it. You know what I mean? So it's not like they've gotten it and just said, "Oh man, we're so thankful that we have this fully insured plan with our 20% renewal, because that is the best option for us." Like, I hate to say it, but that's just not what we see. So the only issue really becomes is sometimes they come get the data too close to the renewal, and then they're just like, it's too much of a headache. We don't want to deal with making the change right now. Okay, well then in that situation, you've done nothing with it. But as long as you get the data early enough and you analyze it, it's going to show you which route is the best route for you, and depending on your risk tolerance. So it really is part of, you know, what are they looking to do with the plan. But you have opportunity, Tyson, to show them this isn't just about the savings on premiums. We can bring in a PBM, and, you know, all this pharmacy spend or all these specialty drugs. Let's see all these Humiras on here, and we can bring in a company like Sharks that's going to get us, you know, Humira for a fraction of the cost or for free on these other programs. So, you know, you actually can see where you can pull away the extra dollars as well. So it's really rare that somebody invests in getting this data and then decides not to do anything with it. So
yeah, I think that timing is really, you know, awesome too, because as you're waiting for your renewal to become available, you can be doing this far before that, right? And so really prepping for things to come, because sometimes, you know, anytime there's change, there's pain, right? So let's say you do stay in the fully insured market, and whether you use a MERP or not, there's always that question of, what is this going to mean to my employees? You know, are they going to not have access to doctors, or, you know, what's the cost of the formularies and those kind of things? And so with this information now, you know, maybe you're not saving on the fees to get the data, but you're probably saving in the static that you're going to pick for employees, because, you know, maybe there's different tiers for the medications of where you're going to where you're coming from, and there's just not enough data to be able to know that in certain kind of markets. And so that this tool does so many different things that are way beyond, you know, anything that I think a lot of people have seen in the past. That's what really makes it so amazing.
Yeah, I'll be honest. You know, when we launched this company, we thought of like one solution, one benefit of this. It'll help you to go self-funded, and then we've learned from advisors and clients how many more uses there are for this service. And so we thought the same thing. So our pricing is built on the idea that you're going to come to us. We're going to get you 2 years of historical data. You can start shopping your stop loss quote, and we're going to keep the system on for the next 60 days to catch any new EOBs that hit as part of the underwriting process to go self-funded. And then you're going to go self-funded, and you're not going to need to know any more claims from Cigna, because you're not with Cigna anymore. However, we've met people right after the renewal that said, look, we want to get our data now. So even though our renewal is not for another 10 months, we want to get it now so we can actually start planning ahead and looking at it. We do have a small fee we charge for the ongoing reporting, and that goes beyond the 60 days, but it's $1 PPM for however many months. So if you got a 50 life group, you're going to pay an extra $50 a month to keep that ongoing reporting for however many months you need it. So that is an option that we've had people, we didn't think that they would need it, but they're like, no, we want to get it now. So we start looking at plan design now, or even look at care advocacy groups and get my group healthier. so that by the end, we know that we are healthy. Right now, maybe we're not healthy enough to go self-funded, but in 10 months, we will be, because we're going to have this data and can manage it. So there's definitely a lot of uses for it.
So does that mean that the data can future forecast too? Does it have like a predictive modeling on a go forward basis, or are they gathering that data just on, ongoing, but it's always like up to date on where the information is going backwards?
Yeah, it's still just up to date with what has been filed. So there's no future forecasting of, we predict this person's going to become a type 2 diabetic, right? If you're asking
Sure.
that. We don't do that. I mean, we do have other analytic companies that we've partnered with that have predictive programs like that, that you can work with. We do just historical. We're pulling that. Now it is near real time though. So when an EOB hits the system, we're checking the member portals daily, some of them even more than once a day. But we're checking them often. So as soon as they hit the portal, it's pulled out and we have access to it. So you are getting real time as the EOBs are generated of what's going on with the employees, what's going on in the plan.
Yeah. I don't know if you want to use this as a sounding opportunity, but I think I saw a post about on LinkedIn that you were talking about what isn't on an EOB and getting some grief about that. Can you share any information there that'd be great for people to hear?
Yeah, I mean, it was just kind of silly. There was somebody that had kind of a personal issue with someone on the company, and so they decided to put out this thing that was like, oh well, EOB data is not real claims data. Okay, so the only thing I want to be clear about is, if you're over 100 employees, you get like a claims report from an insurance carrier. And that report obviously is not going to look the same and be the same as the report we give you, because it is generated by the insurance carriers. It actually doesn't go into as detailed as ours, but it is different. So he was trying to say, like, we're claiming that we're giving you the claims data report when we're giving you something else. And so technically that is true. We're not giving you the exact same report in the same format that people over 100 lives would get. But we're giving you all the information, as you saw. We're giving you the patient, the date of service, where it was at, what the billed amount was, what the discounted code is, what the patient's responsibility is, any adjustments. Like, we're giving you all the information. Not only that, we're giving you what the doctor visit was, the procedure information. On prescriptions, we're giving you what the prescription was. We're giving you the dosing. I mean, it's all stuff that Tyson's team and other care advocacy medical managers can use to implement things, where the actual report that he was saying we're not giving does not give as rich of data. It's actually subpar compared to the information we're giving. So it's just kind of silly. He was trying to point out, like, well, they're not giving what we know as a claims data report. I'm like, that is true. Yeah. We're actually giving you more information than that. And it is based on claims data, but it is from an EOB. So that is something we got to be clear about. Yeah.
Yeah, it's also, I think, really important to highlight again, and you said this a couple of times. This information is not released to the employers. There is a firewall that's definitely set between them and the employees, so they're not really at risk of HIPAA or PHI. And because the employees are giving you authorization, and sometimes even authorization to create an account for them online, recorded, you're following all the rules that have to happen. And then the broker, the consultant's the one that gets access to the information, because it's up to them to make recommendations to the client based off the data. And they're the ones that are also responsible for following HIPAA and PHI rules and everything else.
Yeah, so like I said, we give the two reports, so you have the access with the actual employee names and with the dashboard where it's de-identified. So on the dashboard, it just has the member ID number, and that matches the other file. So you will have behind the scenes to help the plan and to help the employees, and you can still show that dashboard to the employer to highlight, look, here's what we see and where we can save, and here's what we can do. And that dashboard, with it being de-identified, meets all the HIPAA rules and keeps the employer from ever knowing specific about the employees. I mean, really, when they give us access, it's from a legal standpoint, they're giving us a limited power of attorney to access that website on their behalf. Much like with Venmo, you give them a limited power of attorney to access your bank account from a legal standpoint. So when when my team, the dev side of it, the tech is logging in to pull those EOBs, it is essentially logging in as Tyson, as far as the carrier is concerned from that legal standpoint. But we still protect HIPAA in that we're not going to share this with the employer, so that the employer is not in violation. They're not going to see any personal identifiable information through that as well. So, yeah.
Perfect. That's great, man. We've blasted a lot of information out here. I think it's interesting that the original intention was to, or the original thought that self-funding, which I'll tell you, every single client we ever talk to, is interested in self-funding and evaluating whether that's the right choice for them. And it's been limited. I mean, it's like a guess on what's going to happen. And so this tool can really help define that. But all of the other things that it can do is really awesome. I mean, it's so cool that you guys put this together. And I would say in a really simple way to try to see the information and know how to take action on it. So I appreciate the time, Ben, and everything you've done and carved out a little time to educate us on what's going on and what we can do. And for the clients and employers that are on the line today or on the webinar, we look forward to getting the opportunity to dig into this. If you're looking and wanting to justify your renewals or trying to find better ways to provide better health for your employees or health care for your employees, it starts with data. It really does. And so, Ben, thanks again for being on the line with us today.
Yeah, of course. And if we got a minute, I wanted to say one more thing because you kind of just reminded me of it. Is that historically, if you were going to go self-funded, you'd have to do health questionnaires. You'd have to take a lot of risk, but not really knowing what your usage is. And then once you go self-funded, then you get to start seeing behind the scenes and under the hood, right? You get to start seeing the claims as they come through. So now you can start implementing programs to get healthier, to build a better plan for your employees. Well, by using us, you get all that information up front. So you can start that plan design and all of that right from the start. So normally there's like an 8 to 15 month delay. You've gone self-funded. You're now starting to see what's going on. You're seeing your trends, and now you can make changes 8 to 15 months down the road. But with us, you can do that right from the start. So literally you can identify gaps in coverage. So one of our examples too, he was able to identify a gap in coverage as they transition. So he was able to build this in so the family no longer had to pay out of pocket for this special need that they had a dependent. So literally the dependent got better care. The family saved like $7,000 a year of what they had been paying out of network, and they helped the group. So it wasn't just about the numbers. It really is about what you can do for these families and individuals. And you can do it from day one without that year-long delay until you can actually start making those changes. So
that's the thing I'm really seeing that employers are looking for is like, what can we provide that really helps the plan that ultimately provides a better benefit to the employees, right? It's not just adding benefits that cost more anymore, right? I mean, there's the economy and everything that we're going down the road of. That's a little bit of a scary proposition. But retention is so important. So how can we really help the plan? And without the data, it's next to impossible. Or like you said, it's like just throwing things in a dart in the dark room and hoping you hit something right, because it conceptually makes sense. So again, Ben, thanks so much. Is there anything else you wanted to share? Open mic.
No, I'm pretty good there. I feel like we got it out, all the information that's important. And, like I said, I appreciate, our relationship working together, because it really is, we're going to get the data and help in this process. And it's really what you can do with the data that's going to make all the difference for them, to help them evaluate what is the best route to go with their risk tolerance, with their group, the healthiness of their group, and then building out the right plan and the right direction for them. But again, you can't manage what you can't measure. So having data is critical. And then once you have this, being able to do something with it, it goes beyond the numbers. They're going to be able to save money, but they're also going to be able to have a better plan for their employees, like you said. And that's going to help with retention and with their people's happiness when they come to work, right? We all know that happiness translates into more productivity. So it all relates. It all relates.
Yeah.
So,
and I think we said it earlier. I mean, the great thing about this is that we can start before the renewal, and that's probably the best time, to really evaluate what's going on, to get prepared. So then when it's time to make those decisions, you've got all the information. So we look forward to doing that and reaching out and having that opportunity. So thanks again for sharing all that information with us today.
No problem, man. Thank you. Right. Any last questions from anybody that's here?